Americans haven't always been so heavy. Between 1980 and 2014, obesity rates worldwide doubled to almost 600 million people. In the United States, it's an epidemic. The consequences of obesity are serious. It causes a host of health problems like diabetes and heart disease, and increases the risk of others like cancer and arthritis. Obesity costs the United States $190 billion in annual healthcare costs, driving up insurance premiums for everyone and reducing productivity. There are different theories about the drastic rise in obesity rates. Minority and low-income communities have been hardest hit, but obesity affects all races, genders, and socioeconomic classes. Also troubling is that obesity and diabetes are affecting our children in unprecedented numbers, setting them up for lifelong health problems and shortened lives. How should we reduce obesity in America? We'll be deliberating about 3 possible approaches to the problem. One says we should use consequences and encouragement to help people lose weight. Another option looks at fixing the way we produce and market food. And a third option says we need to create a culture of healthy eating and living. Each of these options is rooted in things that we all hold valuable, but each has important trade-offs and downsides as well. So let's look at our options. Option 1. Help people lose weight. Americans used to eat less and get more physical exercise. Today, it's the opposite. This option says that personal decisions have a lot to do with obesity rates that are costing all of us, and as a society, we should use active encouragement and consequences to get people to lose weight. One way we could do this would be for insurance companies to charge higher rates for customers who are overweight, as they already do for people who smoke. But this could unfairly penalize people who are heavy but healthy, or whose obesity is caused by genetic or medical conditions. Or, employers could provide in-house exercise rooms or subsidize health club fees to encourage people to lose weight. But these costs might end up getting passed on to consumers. What if healthcare providers did more to explain the risks of obesity to overweight patients and their children? But then parents who feel pressured and embarrassed might avoid seeking medical attention. All of these actions would put additional pressure and even shame on individuals who are already struggling with the consequences of obesity, many who have medical reasons for being overweight. Could we accept that? Option 2. Improve the way our food is produced and marketed. This option says it's more than a matter of willpower. The way we produce and market food is driving our nation's obesity problem, and we need to clean it up. Our stores are full of processed foods, quick, tasty, and often unhealthy. They're loaded with calories and sugar, usually made from corn. To be healthy, sugar should be less than 10% of our daily calories. That's hard to do when relying on processed food. Adding corn syrup to food to make it tasty is inexpensive, partly because tax dollars subsidize corn production, $81.7 billion since 1995, compared to just $637 million to support production of fruits and vegetables. What if we cut government subsidies for crops that are primarily used in unhealthy food, or added a tax on high-calorie sugary foods? This would require a fair definition of unhealthy and would hurt many businesses and their employees. And the added cost of processed food would hit low-income families the hardest. In poor communities, access to anything but processed food is often limited. Supermarket chains tend to locate near wealthier neighborhoods, leaving more than 23 million Americans without healthy food options. Cities could improve access to farmers markets or help equip local convenience stores with fresh food storage equipment, but other businesses might see this as unfair help. By the age of 5, the average American child has seen about 20,000 TV ads for unhealthy food. This option says we should restrict junk food advertising targeted to children, but this would interfere with the rights of businesses to sell their products. Most of the actions called for by this option would restrict the freedom of businesses, markets, and consumers. Can we live with that? Option 3. Create a culture of healthy living and eating. This third option says we need to look at the larger picture, changing the way we live to prevent obesity before it begins. One way to do this is to walk more and drive less. Modern neighborhoods and shopping districts often discourage walking or biking. Residential neighborhoods and stores are often spread out, with few sidewalks or pedestrian-friendly features. That means driving to stores, churches, or schools instead of walking. To counter this, zoning laws could require that new developments include bike paths, sidewalks, car-free zones, and open space. But all this will raise the price of housing in those developments and will take years to implement. Banks and lenders could support the development of walkable communities that have a mix of residential and commercial uses, but lenders are less likely to finance those projects in low-income areas. This option also calls for starting nutrition and wellness education with the very youngest students and continuing to make it a significant part of the school curriculum through graduation. But decreasing the time spent on academics won't help American students close achievement gaps with other countries. Overall, this option relies on building for the future and would make our neighborhoods look very different, and it doesn't address the obesity problems we face right now. Can we live with that? Obesity in America is an epidemic and shows no signs of improving on its own. We've looked at 3 ways to address the problem. Now it's time to weigh the options and consider what actions we should take and what we're willing to give up. So let's get talking.